All right, can everyone see my slides?
Yes.
Thank you. Alrighty, we are excited to be here and talk about dental benefits. This is DenCap's 41st year of providing dental insurance for Wayne County employees, and we are happy to do so. During open enrollment this year, we are again offering two plans, the Smile Guard and Premier. We'll talk more about the differences between the plans in a moment. Remember, we are a DHMO, which means you must see a dentist in our network. You'll also receive a schedule of benefits and fixed copayments, which means there will be no surprises around your cost of treatment. When it comes to your oral health, be your own advocate. You can ask for a written treatment plan and feel comfortable to ask questions, including if there are alternative treatments. The first of our two plans is SmileGuard. SmileGuard is a full coverage dental plan. It includes 100% coverage for preventive services such as cleanings and checkups. It also covers 50% of major treatments like fillings, crowns, root canals, and dentures. We offer $12.50 annual maximum for general dentistry. Specialty care like oral surgeons or periodontists is covered up to $500. Orthodontic coverage is also included with $1,800 of coverage for those under the age of 19 and $1,500 for adults up to the age of 19. I'm sorry, 19 and up. The Smile Guard plan was designed to give you a peace of mind. You can think of it as your safety net for those times when you expect a standard checkup but end up needing more work done. It offers balanced protection for routine care and is ideal for employees who want solid coverage without surprise dental bills. The Premier Plan is our newest dental option that provides the highest maximums in orthodontic coverage offered to you and a buy-up option. It has better coverage, like 85% of the cost for fillings and root canals, and covers 80% for major procedures like crowns, partials, or dentures. You have a $3,500 maximum for general dentistry, a $1,000 maximum for specialty care, and ortho is covered at $2,000 for children up to the age of 19 and $1,200 for adults over 19. The Premier Plan is designed for members who want the highest level of coverage available. It's ideal for anyone who wants peace of mind before their next dental visit, especially if you anticipate more extensive dental work. The best part is that the plan starts at $12.50 per month for single coverage, $45 per month for two people, and $80.50 per month for a whole family, giving you enhanced coverage for a reasonable price. Since we are a DHMO plan, it is important to stay in network to ensure your services will be covered. If seen out of network, you will be responsible for the services rendered. If you are concerned that you may have a dental emergency at some point when you are not near your dentist, reimbursement for treatment you may need to help relieve you of any pain you might be in. Currently, we have 190 general and specialty offices in our network. Some are private practices and some are larger chains, but all are easy to find and offer quality care you can trust. We've made finding a dentist near your home or work simple. Please call us or visit our website at dencap.com. We want you to make the most of your dental insurance. You can do this by knowing your plan. Review your schedule of benefits so you'll always be aware of your out of pocket costs. Scheduling regular checkups can save you money in the long run and help keep your smile healthy. If you're someone who needs a lot of treatment, we have you covered with a high maximum, so be sure to utilize it. If you happen to reach your max, it will restart again in 2027. We issue ID cards, and new enrollees will receive them at the end of 2025. ID cards also come along with a schedule of benefits to prepare you for your dental visit. Your ID card will include plan information and also who's covered. Okay, so I'm sure everyone on this call has contacted a service provider at one point or another and was placed into an automatic call tree. Well, not at DenCap. Our customer service is live and local, which means you will never be placed into a call tree and will reach a friendly, knowledgeable rep each time you call for assistance. Here are a few common questions we receive. Members often contact us regarding billing and if changes to their dental location can be made. If you have any more questions outside of what's on your screen, please don't hesitate to reach out and we will gladly assist you. Thank you for your time. It has been my pleasure to present for DenCap today, and you all have a great rest of your day.
Thank you, Serena. We have one question for you. Are composite materials for fillings, caps, etc. covered, or are we required to cover the difference in cost between the composite and a more traditional material such as silver? So Matt wants to know.
So the plan does offer both composite and amalgam coverage. I can, if you would like to reach out, I can pull up the plan and get more specific details depending on which type of you're looking for.
Okay. All right. If you guys have any materials or flyers and you want to email them to us, we'll make sure that we put them on our site so everybody has access to them.
Okay, yes, absolutely.
Okay, thank you so much. Okay, and with that, we are going to move on to our vision with Heritage Vision. And Lenny, are you still with us?
I am. How are you?
Okay, I'm great. How are you?
Great. I had to switch to my headphones because my neighbor, love him to death, but he decided to pull out the turbo leaf blower when this call started. So I did not want that to be a distraction. So I figured I'd just better play it safe and put my headphones on.
Well, thank you for that.
So let me share my screen and we can get started. I can adjust the size too if need be, but can you see that clearly?
We can see it, but it probably will get smaller as we move into your presentation. But for now, yes, we can see that clearly.
Okay, great. I'm going to go off camera while I present. Okay, good afternoon, everybody. My name is Lenny Barnes, and I'm the VP of Sales and Business Development for Heritage Vision Plans. Happy to be here to present to you the open enrollment information for the upcoming plan year. The good news is there have been no changes, but I would like to go through the plan for any new employees. It's been an honor for us to be working with the county for a number of years now. It's a relationship that we value highly. So I always enjoy having the opportunity to present when we have these virtual meetings. And this past July, we just celebrated 50 years in business. So that was really exciting for us. If any of you are familiar with my father, please tell him it's okay for him to retire and I will take over. Everything will be just fine. So let's go through the information. So for any of you who are not currently enrolled in Vision and you're kind of trying to figure out why you should, well, there's a number of reasons. Number one, eye exams are important to overall health. And I think as you heard in the dental presentation, between dental and vision exams, some very serious illnesses can be detected early and really lessen the impact on your major medical, because really all the carriers here, this is all about total employee wellness, and early detection is the key, and that happens not only in your medical exams, but it also happens in eye exams. And eye care is for the whole family. As we all know, we stare at a lot of screens now. Our children are exposed to screens more earlier than they ever have been. And we've seen a trend over the last probably 5 to 7 years of young people needing some sort of eye care product much earlier than in previous years. And more importantly, vision insurance can save you hundreds of dollars per year. Don't want to go down a rabbit hole, but there's no ignoring the fact that with the tariffs that have been hitting, that it's touched every industry. Vision is not immune to that. So we have seen that affect the price of some frames that come from overseas. So having vision insurance now is more important than it ever has been. And changes in eye care can be hard to spot. And again, that just reinforces the need to have an eye exam. And of course, for those of you who like to express your personal style, it's great to have different pairs of glasses to do so. So now let's talk about the actual vision coverage. Deborah, does that screen still look large enough? Is that good, or do I need to enlarge that?
No, that's good.
All right,
Thank you.
perfect. So again, for the new plan year, Wayne County employees have the option of 3 different plans: the base plan, enhanced plan, and optical reimbursement plan. Now, I'll go into a little more depth with that optical reimbursement plan a little later in the presentation. But there are, as you see, 3 different levels to that reimbursement plan, which are 75, 150, and 175. And those levels are dictated, if now I'm not mistaken, by allowances that are already figured into the contract for those particular groups that are enrolled in those reimbursement plans. But I will talk about what we did as an enhancement when we get into that part. So highlights of the base plan: exam, eyewear, and contacts every 24 months, no copays, and you have access to the Heritage Vision Plans national network, which is consisting of 31,000 providers throughout the 50 states. The enhanced plan, that is every 12 months as opposed to the base, which is every 24. There are higher allowances, and then there are also some standard options, which include progressive lenses, polycarbonate lenses for children, and contact lens fitting benefit. Again, the same national network is available if you choose the enhanced plan. And again, the optical reimbursement plan, which we became the program administrator back in 2023. And that's significant because prior to that, that reimbursement plan was being handled in-house by Wayne County. And so when we took that over, we also wanted to provide a benefit for the members who are in that reimbursement program. So here's what we did. As opposed to just going to a provider and then having to get a receipt or submit a claim form to get reimbursed, the enhancement that we deployed was that if you utilize an in-network Heritage National Network provider, you can use the allowance at the point of purchase as opposed to having to submit a claim and wait for the reimbursement. And in addition to that, you will also receive an additional 20% discount over and above whatever allowance that you have in your optical reimbursement. So that's something that I think has worked very well for the members, and it really cuts down on the members having to worry about getting a claim form or getting an itemized statement to then submit for reimbursement. So let's talk about the base plan first. I will go through all the components of that. As I said, the comprehensive exam is covered at 100% with no copay. For the frames, you have a $75 retail allowance, meaning if the frame was $100, 75 of that would be covered by the plan, and that $25 would be discounted at 20%. So all 3 of these plans, anything over your allowance will be discounted at 20%. Any of you folks who might shop at Walmart or Sam's Club, their vision centers are also in the Heritage National Network. So that retail allowance equates to a level 2 frame selection in the Walmart and Sam's Club vision center. So something to keep in mind if you happen to be in there. Feel free to drop in and take a look and see what frames are covered at that level 2. So let's talk about lenses. So the lens options you have in the base plan are single vision, bifocal, trifocal, and lenticular. And in this modern day of technology, to be honest with you, While we do offer those, because there are still some people that prefer a bifocal or trifocal with a line, we don't see that much, but they're still in the plan and they are covered. Um, so single vision lenses are 100% with no copay, as are bifocal, trifocal, and lenticulars. And again, lenticular lenses we don't see very often. We used to see those a lot when folks had cataract surgeries. That lenticular lens would be the option after surgery. However, most people who have cataract surgery now have an implant, so we don't see much of that. But nevertheless, we still include it just in case, in a rare case that someone needs that. So in the base plan, all of those standard plastic lenses are covered with no copay. All your lens options are discounted at 20%. A standard solid tint in all colors is covered 100% with no copay. And as I said, any other options like UV coating, gradient tint, polarized, polycarbonate, shatterproof lenses for children in the base plan are discounted at 20%. For contact lens services in the base plan, a standard fitting is discounted at 10%, and a premium contact fitting is discounted also at 10%. You have a $100 retail allowance to put towards those contact lenses. And for those of you who may fall under the medically necessary designation for contacts, and what that means is that your vision can only be corrected with contact lenses, you would get 100% coverage up to the usual and customary amount. That typically is around $200 to put towards contacts in medically necessary designations. And let me also just clarify the difference between a standard contact fitting and a premium contact fitting. A standard contact lens is basically a lens that corrects vision for anyone who does not have astigmatism. A premium contact lens is more for people who have a little more specialty needs. For instance, if you have astigmatism, you need what's called a toric lens. That is a premium lens. Or if you need a gas permeable lens, or what's called a semi-soft, that would also be considered a premium contact lens. Some people need those gas permeables because their eyes change rapidly, and the doctor has determined that using a semi-soft or somewhat rigid lens will keep the cornea from changing shape as rapidly, and that's why you may be prescribed a gas permeable or semi-soft lens. So I just wanted to just share that, just for anyone who has heard those terms but just wasn't sure what they were. So in addition to those options, there's also a 20% discount on second pairs at all Heritage providers, and anyone interested in LASIK surgery. We have a relationship with LASIK providers, LASIK Plus. You can get 15% off on LASIK services as well. We also have a relationship for hearing aids with a company called Amplifon, and you can call our customer service department to get more information on that, or visit our website at heritagevisionplans.com. The customer service number is 800-252-2053. So that covers the base plan. Let's move to the enhanced plan. And as I said when I was going through the highlights, one of the biggest differences between base and enhanced is that base is every 24 months or 2 years. The enhanced plan, you can utilize your benefits every 12 months. So that is a big difference between the two plans. And on all of these plans, the dependent coverage is up to age 26. So keep that in mind. So if you have some college students, they are still able to utilize these benefits. And the great thing about having the Heritage Vision Plans National Network is that if you have a college student down south, they can still use the benefit because our network is, again, as I said, throughout the 50 states. So let's get into this real quick, into the enhanced plan. The eye exam is covered, but there is a $5 copay in the enhanced plan. Now, your frame allowance is considerably higher in this plan. In the base plan, it was $75. Here in the enhanced plan, it jumps up to $130. So that is a significant difference. And again, same thing. Anything over and above that $130 that you spend will be discounted at 20%. And again, in the Walmart and Sam's Club Vision Centers, this plan goes up to a level 3 frame. So if you're curious about that, as I said, you can stop in and take a look and see what level 3 gets you at the Walmart and Sam's Club vision centers. Now let's talk about the lenses because there are some different options here that were not in the base plan. The single vision, bifocal, trifocal, and lenticular are again covered, but there is a $10 copay. Now, here's what's different. In the enhanced plan, you get progressive coverage, which is significant because you have a standard progressive and a premium progressive. The difference between those two is basically the field of vision. A standard progressive, which I am wearing right now, will give you more than adequate coverage for any kind of work that you do if you're looking from your computer screen to a paper or to any printed material. But that premium progressive gives you a wider field of vision in that intermediate and up close range. So basically, everyone, a progressive lens is an invisible trifocal. It gives you three different types of vision fields. In a progressive, you have your up close, your intermediate range, which is about where your computer monitor is when you're sitting, and then distance. So that's what a progressive is. It's 3 fields of vision. So let's talk about that coverage. The progressive standard is 100% covered with a $50 copay. Now, if you go to a premium progressive, I'm going to read the coverage, then I'm going to break it down for you. 80% of the difference between the standard and premium, plus a $50 copay. A lot of words there, so let me just break it down into numbers to help you understand it. So let's say that a premium progressive was $600 and a standard progressive was $400. The difference between those two is $200. So you would be responsible for that $200. However, the Heritage coverage kicks in and covers 80% of that $200, which is $160, leaving a remainder of $40 plus a $50 copay. So in essence, you're getting a progressive lens for $90. And these are numbers that I rounded them to make it easy to illustrate how the coverage works. But depending on what providers you go to, those numbers will change, but the coverage will not. So keep that in mind that 80% of that difference between the two is covered by your Heritage plan, and then you just have an additional $50 copay. So that's how that progressive coverage works. And let's go into the lens options. Again, very similar to the base. All extras are discounted at 20%. However, here are 2 differences. The polycarbonate shatterproof lens is covered with a $10 copay for children, where that is not the case in the base plan. So if you have any young people wearing glasses, take advantage of that, because that shatterproof lens also has ultraviolet protection and scratch coating already built in as a property of the lens. So that's a great lens for young people who tend to be a little rougher on glasses. So that's something to keep in mind. And again, the tint is covered 100% with no copay. I would like to mention one thing. I think we've all seen mention of blue light protection and blue light filters. Transition lenses will take care of that as well. So any of you who are interested in transitions but also concerned about blue light, I would strongly recommend moving to a transition lens, because not only is that going to filter blue light, but that's also going to give you that protection when you go outside with the darkening of the lens. Just something to keep in mind. Now let's move down to the contact lens services. Again, we've got the same situation with standard and premium contact lens fittings. Difference here is that the contact lens fitting is just for standard, you just have a $40 copay and that's it. But with the premium, you still are at a 10% discount. Much like the frame allowance in the enhanced plan, the contact lens allowance is also a little bit higher. It goes from 100 to 130. So that's also something to keep in mind. And it's the same setup with the medically necessary that's covered to usual and customary. Okay, so now let's talk about the reimbursement plan. Again, as I stated, there's 3 levels. There's 75, there's 150, and then there is 175. All of those plans operate the same as I stated. Very simple. If you go into a Heritage provider under that optical reimbursement plan, you can utilize those allowances at the time of purchase without having to submit for reimbursement. So that makes it easier. If for some reason your provider is not in network, in that case, you would need to get an itemized statement, and you can send that in. And also on our website, there is a claim form that you can download and fill out and send that in to us as well. Now, let's talk about a couple of different details with this reimbursement plan. So the reimbursement plan, you are eligible for that every other calendar year, not every year, but every other calendar year. And that goes through for all three plans. It's not really that complicated, but if you still have questions on those three reimbursement plans, again, feel free to reach out to our customer service department. We will be happy to walk you through it. But I think by us taking over administration of that and allowing the utilization of that allowance at point of purchase really makes a big difference and really lessens the hassle for those of you who might be in that reimbursement plan. So that covers the benefit itself. And again, you know, one of the things that we're very proud of is our network. As I stated, it's a very extensive network. Pretty much all the major retailers that you're aware of are in this network. We've got a real nice mix of very large retailers and private boutiques as well. This is just a snapshot of some of them that are in the network throughout the country. And again, you can also go on our website and search for providers, or feel free to call customer service and they can help you locate a provider near you or near a dependent that may live out of state. Just a quick illustration of the difference in savings when you have insurance versus not. I won't really bore you with those numbers. As I think we all know, if we wear glasses, having insurance definitely makes a difference when it comes time to reach in your pocket and cover those needs, as opposed to just paying for everything yourself, because just exams alone can go anywhere from $60 to $150 just for the exam. And if you multiply that times 4 or 5 family members, you're talking about a significant number that you have to cover just for the exam. So having this insurance, whether it's the base or enhanced plan, definitely makes a difference. Kind of went over some of this already about using the benefit. I will say this: once you become active, you don't need an ID card. However, once you become a member, you can go on our website and download an ID card if you just absolutely need to have something in your hand, if that makes you feel better. Certainly understand that, but we're just really trying to lessen our impact on the environment and reduce the amount of paper and plastic that we utilize. So you have to just simply call your provider and tell them you have Heritage Vision Plans coverage, and they know exactly what to do from there. So again, as I said, if you absolutely want an ID card, you can download it on our website. Again, heritagevisionplans.com. You can visit us online, do a provider search. You can also make appointments with the providers online as well. And finally, I'll just go through a few of the frequently asked questions. I won't hit all of them. One of the ones I do want to talk about, though, because I've given you the customer service number. I'll give it again at 800-252-2053. Our call center operates Monday through Friday, 9 a.m. to 6:30 p.m. and on Saturday, 9 a.m. to 4 p.m. One thing that I do want to talk about, and that is about a situation if you go to get a standard eye exam and discover that there's some sort of pathology, and then you are referred to an ophthalmologist. So the difference between an ophthalmologist and an optometrist is that an ophthalmologist is an MD and they can do surgery and they can do more complicated procedures and treat any pathology of the eye. So let's say that you do go to the doctor and you are referred to a specialist for a specific disease. So what would happen there is that coverage would then move to your medical, because that MD is going to bill your medical insurance. And at that point, the Heritage coverage will not come into play until after you've been treated. And then if you are able to get glasses from that point, then we can move back to the Heritage coverage. That's something that comes up a lot. So I just wanted you all to be aware of that if you do go under the treatment of an MD or a specialist, your major medical insurance is going to pick up that situation until you get moved back to glasses, and then you can go back to the Heritage coverage. So that about does it for my presentation, and I will take any questions that anyone has. Deborah, do we have any questions?
Yes, we do. Paula wanted to know, are you able to use Costco Optical with the enhanced vision plan?
Currently, Costco is not in our network, but I am working on that diligently. I've had some conversations with them. I think that's just going to be a matter of working through some contract situations. I can't give you a date yet, but please know that I am working on that. And for those of you, I did fail to mention that as of last January, LensCrafters became a part of the network as well. So please know that we are always working to enhance the network and bring in as many providers as we can. Our network is not closed by any stretch of the imagination, but stay tuned for information on Costco. Stay tuned for that.
Okay. And Avis wants to know, I thought the buy-up plan was every year for glasses and exams.
It is. Everything is, if when you go into the enhanced plan, the entire benefit schedule is every 12 months. It's the base plan that is every 24.
Any other questions? That's it for the chat. If there aren't any other questions, again, our presentation was recorded. I want to thank everybody for joining us today. And remember, open enrollment is November 3rd through the 24th. Blue Cross, Delta, DenCap, and Heritage, thank you so much for your valuable information regarding our healthcare plans and answering our questions. This presentation, again, was recorded and will be available on the benefits team website. However, for additional assistance, please contact the benefits team at benefits@waynecountymi.gov, or you can call us directly at 313-224-5157. We do have several events planned for you to learn about all your benefit plans. So watch out for the eBenefits open enrollment webinars. We're going to have Ask Benefits again, and join us for our live open enrollment kickoff event with your vendor representatives, including Empower on November 4th in the Guardian Building on the 32nd floor. And it will be from 10 a.m. until 2 p.m. So this concludes today's session. Thank you again, everybody, and have a great day.
Thank you.
Thank you. Have a
Thank
great
you.
day.
You too. Goodbye.
Bye-bye.